Okay, so this is part 2 of the Inequity of COVID, effective leadership for diverse teams, effective leadership for diverse teams through pandemic and beyond. I am Kristen, and Kristen Ingenito. I work for MarketScope, and I'm also on the board of OWL and chair of the Membership Impact Committee. So thank you guys for joining us. And today I want to reintroduce our speaker from last week, Kweilin Ellingrud from McKinsey, to take a quick look at what comes next after COVID. How do we lead through this pandemic? How do we continue to manage our teams appropriately and kind of face these hurdles that we're all seeing? So before we get started, I want to just take a brief moment to thank our sponsors for their continued support of OWL and enabling us to bring programs like we have today for you. So our sincere thanks goes to Yari, Allergan and AbbVie Company, Alcon, Horizon Therapeutics, Johnson & Johnson Vision, Novartis, Star Surgical, and Zeiss. We appreciate your support of our mission to advance diversity and leadership within ophthalmology. So this is Kweilin Ellingrud, Senior Partner at McKinsey & Co. She's the co-author of the Future of Work Post-COVID and Power of Parity papers. She leads a range of research, including on gender equality globally and the impact of COVID-19 by gender, race, education, income, etc. She's a member of the McKinsey Global Institute Council and the first woman to lead the Minneapolis location and a leader of the North America operations practice. So Kweilin, why don't you go ahead and get us kicked off here?
Wonderful. Thank you, Kristen. Excellent. We wanted to just give a very brief overview of what are the trends that are persisting post-COVID. How will that shape the future of work over the next 5 to 10 years? And how does that impact different groups differently? So this is going to be just a brief context setting before we get to know our panelists a bit further and hear some of their insights. As we stepped back from all of the trends that were existing pre-COVID, there were 3 broad groups of trends that existed before that were accelerated during COVID, and we think are going to shape the future of work after COVID. So a brief overview of these 3 trends, and then I'm going to jump into one of them, automation, this third trend in particular. So the 3 groups of trends, one is remote work, virtual meetings and travel. No surprise to this group as we convene over Zoom. Work from home is increased. We think that will persist after COVID. In fact, 70% of employees have said that being able to work from home at least 1 day a week is a top criteria, a top 3 criteria in choosing my next job. We think business travel will be down. It will slowly edge back up, but probably level out at about 80% of pre-COVID travel. So on average, you'll take 1 less trip a month kind of thing, or do 1 more meeting over Zoom or over video conferencing that you might have traveled for before. Leisure travel will jump back to pre-COVID levels after an initial spike above that, as people who have not seen their loved ones and friends and family for a year, year and a half start to travel again at much higher rates, but then settle into pre-COVID levels. Over on the right, you see the second category of trends, which is all around e-commerce and virtual transactions. And we're getting a lot of online ordering, Amazon, your grocery delivery, your takeout, even online education that has been broadly viewed as more successful for older ages than for younger children. As the mother of 3 young daughters, I can attest to that piece of it. And telemedicine. Across the board, we think these will be much higher levels of usage than pre-COVID. So when you do surveys, for example, and this is true around the world, most people say, yes, I will use grocery delivery, online, ordering, takeout a lot more than I did pre-COVID, probably not as much as I do now, but it'll settle back into something that's a little higher than the pre-COVID baseline. Telemedicine will also be up, although for certain types of things, colds, less serious things, for example, that don't require that in-person examination, and online education for some things versus, let's say, elementary school education. And the third category is on automation and artificial intelligence. And this is the trend that has been perhaps the most accelerated, pretty dramatic. We were already seeing pretty big shifts in automation and digital before COVID, and then overnight, a really significant shift. Unfortunately, it is impacting many of the same jobs, activities, occupations that COVID is. So we've got the coming together of COVID-19 and automation affecting many of the lower wage jobs, higher manual labor jobs, a lot of the interpersonal interaction jobs, and unfortunately, many of the minority groups disproportionately. So let's dig into that third theme in a little bit more depth. When you bring together both automation trends and COVID-19 trends, here is the shift that you see in skills that we're going to need. And if you look on the left, what we did was we looked across 800 different occupations across the United States. We broke those down into the underlying activities. And what you see here is the average mix across all occupations of how we spend our time in work. About 30% of that time is physical and manual work, about 18% basic cognitive work. So can I look at simple data and make a very simple judgment? 22% is higher cognitive work, so problem solving, innovation, deeper collaboration. 19% is social and emotional work. So can I read a human reaction and react accordingly, right? Can I interact with you in a very logical way? Can I empathetically kind of listen to your problems and help you solve them? And then 11% of our time is spent on technological work. Not necessarily can I code, although that's part of it, but can I interact with technology? Let's say if technology is monitoring this conveyor belt and look when there is a red flashing dot, can I intervene and replace the part that needs fixing, but following the technology and the monitoring, for example. And what you see here in the middle in the blue, the light blue, is that we're going to need a lot less of some of these skills going forward. We're going to need a lot less basic cognitive skills, less physical and manual skills, and higher cognitive skills. And in fact, COVID-19 has accelerated what we were already seeing in terms of the baseline automation scenario. On the other side, we're going to need a lot more technological skills and social and emotional skills. And again, COVID dramatically accelerated what that baseline automation scenario was already telling us was going to be the long-term trend. So the key takeaway here is we will need very different skills and much more of the technological and social and emotional skills. If you flip to the next page and you aggregate up each of those underlying skills into occupations, right, overall jobs, this is going to change the landscape of jobs, which occupations are growing on the left side and which occupations are shrinking, and frankly shrinking to a pretty significant degree on the right side. So on the left side in bright blue, you see we're going to need a lot more, roughly about 1 million more than we did pre-COVID, health aides, technicians, health professionals, STEM professionals, and a lot more transportation services. On the flip side, on the right, we're going to need a lot less office support, which is primarily administrative assistance, almost 1 million fewer because of COVID. 3 million fewer customer service and sales, as much of that goes online, and even the interactions that you do have in person could be facilitated by technology. And about 1 million less of food services, which is waiters, bartenders, et cetera, right? You might have a reopening of restaurants, but even when you go to a restaurant, do you order from an iPad at your booth, and then the food is certainly delivered to you, but you need less waiters or fewer bartenders than you perhaps did before. And so significant drop in the occupations there on the right side: office support, customer service and sales, and then food service. In fact, as we look at all of the jobs that are going to be shifting over the next 10 years, about 17 million people in the United States are going to have to change jobs. 15 million will have to change entire occupations. And 80% of those fall into those three, or if you add manufacturing along with that, 3 or 4 categories. So that is where the bulk of the occupation shrinking will take place: office support, customer service and sales, and food service. If you flip to the next page, beyond occupations, this is going to be the largest reskilling challenge that we have seen in the United States at the scale of 17 million workers in the US alone, not counting globally. And this is going to require federal government, state government, as well as employers to look at reskilling at scale, right? How do we reskill, retrain, think about career paths over time so that the very people we have now can fill the jobs that we need tomorrow? The good news is that there will be more jobs between, demand growth and aging and what we need in terms of, automation. There will be more jobs tomorrow, but the types of jobs we need will be higher skill, generally higher education level, and this long-term ability to learn and adapt will be even more critical than it is today. So here you see a number of examples of companies that have started to drive reskilling at scale, and very different themes. Some have stepped up in their digital push. Others have been very creative in allowing workers, even kind of typically in-person workers, to work remotely. Walmart has, for example, invested about $4 billion in reskilling and launching their $1 per day college. On the right side, you've got Google, IBM, and Hilton saying, you know what, we no longer require a 4-year degree to work for us. And in fact, Google launched a programming kind of degree system or training system globally, frankly, open to all, that is partially another recruiting funnel as well. And so learn to code, and we will judge you based on how you code or how you tackle these real world scenarios, not necessarily whether you have a 4-year degree or not. You also have Starbucks and other employers really expanding their care support, especially during COVID, and other organizations expanding their mental health support. So a number of companies really tackling upskilling and reskilling at scale. And on the last page, I'll just wrap it up with, this is a challenge now. We've seen COVID affect women, people of color disproportionately during kind of this last year of COVID. But it doesn't stop there. As we look ahead to the recovery, the overall jobs will recover in around 2023, right? We're very close now on fully recovering from a GDP perspective, but we recover from GDP much faster than we actually rebuild the jobs. And that's been true in the US economy time and time again. That was true in 2008, 2001. Each time you'll hear economists talk about, oh, the jobless recovery. And this time, especially as we combine COVID with automation, this time is no different. So overall jobs recovering around 2023. Unfortunately, it will take women 18 months longer than men, not to recover to full equality or to close the gap, but just to get back to the inequality levels that we were at pre-COVID, 18 months longer for women. On average, it's about a mix by race. Education levels, though, and income levels or average wages are pretty dramatically different. These two tend to be highly correlated in the US and more broadly. It'll take 2.5, even 3 years longer for those who have less than a high school degree or less than a bachelor's degree to recover. Same thing for those earning a lower income, less than 25,000 or less than 35,000 versus those earning more than 75,000. So those discrepancies pretty stark in terms of that job recovery. So basically, on the way down, COVID has impacted diverse people in our economy much more than others. And as we look ahead to recovery, it's going to take 1 to 2 to 3 years longer for those very groups to recover. So a bit of the backdrop as we get to know our panelists a little bit more and hear some of their insights.
Thank you so much, Kweilin. That's it's a great recap, and of course, always shocking to see those numbers about recovery. So from here, I'll have my panel go ahead and turn their cameras on so you can see our wonderful panel. So we're very, very excited to have Yari Mitchell from AcuFocus joining us today. She's the Chief Business Development Officer responsible for global commercial and business strategy. She has a 20-year career in ophthalmology focused on developing and delivering anterior segment medical device innovations, including wavefront guided laser vision correction, corneal inlays, and premium IOL technology. She's, of course, a past president of OWL and the 2018 Ophthalmology Innovation Summit Rising Star Award winner. She's a bonus mom of 2 and a Peloton enthusiast. Welcome, Yari.
Thanks, Kristen.
We've got Dr. Zaina Al-Mohtaseb here with us. She's an ophthalmologist specializing in cornea, external disease, cataract, and refractive surgery. She earned her medical degree with honors from Baylor College of Medicine, where she completed her residency and was elected chief resident. She then did her fellowship in cornea, external disease, cataract, and refractive surgery at Bascom Palmer. And she's associate professor at Baylor College of Medicine, as well as the associate residency director, and is the incoming chair of the ASCRS Young Eye Surgeon Committee. In her free time, she loves spending time with her husband and her 2 children and her parents. Welcome, Zaina Al-Mohtaseb. We appreciate you being here with us today.
Thanks, Kristen. Happy to be here.
Thank you. And lastly, we've got Dr. Frank Bowden. Dr. Bowden is a corneal glaucoma and refractive surgeon, as well as a dry-eye ocular surface specialist in Jacksonville, Florida, where he has spent 31 years in private practice. He is the founder of Bowden Eye Associates and a comprehensive practice with 3 locations, and is the owner and medical director of the Eye Surgery Center of North Florida. He's currently the Chief of Ophthalmology at Baptist Medical Center Systems in Jacksonville and the co-founder of Dry Eye University and Dry Eye Access. He was valedictorian of his medical class in Harry Medical College in HBCU and has the distinction of being the first African-American to complete an ophthalmology residency in the US Navy and the second African-American to complete a corneal and external disease fellowship at Wills Eye Hospital. And fun fact, he was the ophthalmology consultant and provider to the Jacksonville Jaguars in the NFL for 23 years. So I'm sure you have wonderful stories from that experience, Dr. Bowden.
Yes, indeed. Thank you very much.
So guys, I appreciate you all being here. We're going to kind of jump into some questions that I think a lot of us have been pondering over in the last year that we've had a lot of additional time to think. So I'm going to jump off here, Dr. Al-Mohtaseb. I know that you had a child during all of this. As a surgeon and a mom with a busy career, I mean, you're an opinion leader now. How have you found ways to prevent your burnout or just take care of yourself through all of this?
Well, it's interesting that you bring that up. In April, when I had my son in the middle of COVID, I just thought, things really couldn't be more difficult, right? We were worried about COVID, we had isolation, and even before that, having one child and trying to balance kind of work and career and things that I love and have worked so hard for, but then also family. And then in the midst of all that, we actually also, my only sibling passed away in July. So it really was, this year humbled me, made me truly accept my vulnerabilities. And I think, first of all, the answer to the question is I haven't figured out everything, but there are some things that have helped me through this year. And I think if you ask anybody that it's been just a tough year also for them, I think one thing is just acknowledging you can't do it by yourself and you can't really be 150% in every aspect of your life. You can't just be on all the time. Sharing your vulnerabilities with people, relying on close friends and family, so many mentors and so many people reached out who have experienced similar, difficulties and it just becomes much more real and really sharing your vulnerabilities. Others will share how to get through it. Making the time, taking a step back. I took some time off to be with the family. I'm very lucky to be at Baylor where I was in academics. I could be flexible and kind of backing off of the private aspect and replacing that time with staffing kind of in the residence. You give up money, you sacrifice that, but then it allows you to go slowly back into what you're doing. Very lucky with COVID, everything was virtual. So after the kids go to sleep, I can do the webinars and the intellectual aspects of the things that I loved or, doing the publications and more importantly is just making time for yourself. The Peloton, I think my husband got it for me. And when he first got it, I was like, are you implying something? Eating Nutella at night was not the thing to do. But it's life-changing because you connect with people and you make time to take care of the health aspect. So, I guess the answer is I don't have the answers, but it's a work in progress. But I think there's so many ways to just start that way.
Yeah, absolutely. And I think we've seen that, being a leader, you have to take care of yourself. You can't show up for other people if you're not taking care of yourself too. Yari, I kind of want to point the same question to you. You have been trying to, commercialize a product and get through clinical trials and doing all of this. How have you found balance in all of this?
I think this last year has represented the most stressful year probably for everyone because everybody got, thrown in their face so many different challenges and so many different issues. And, I think the personal side of things, your home life really invaded your daily life. And, as much as we have these Zoom interactions to try and maintain connectivity, your whole world is kind of on display. And so one of the things that I tried to do was lean into, humor and try to find ways to, help myself feel good about being stuck in my house with my family. I love them, but after, so many hours in a day, it's hard to still love them as strongly as you do when you first wake up, depending on the day. But yeah, you got this wonderful display here. So I wanted to try and share some humor as well, just what can I do when I'm sitting here at home during COVID? Well, I've got like my wedding dress. Does this thing still fit? Let's see. And then I have this other ridiculous dress and wig, so why not? So I started publishing on Instagram, and yes, all of this mayhem to try and, number one, keep myself sane, but also hopefully bring some joy into other people's lives. As we thought going home, it was only going to take 2 weeks, then we'd be back in the office, and then it became this protracted experience of how do you stay focused at work and keep your kids focused, and then not go totally crazy. So this and Peloton were kind of my two outlets for not going crazy.
You can keep those pictures up. That's fine. I enjoy, I know I enjoyed the pictures, Yari, and I appreciate the effort put into that because it certainly brightened some of our days too. Dr. Bowden, we were talking about, how you've kind of broken up some of your responsibilities in your practice. We know CDC is always changing guidelines here, and this is an ever-evolving scientific process that's happening in front of us. Do you have a point person in your practice, that's handling these challenges for you?
Absolutely. I have a very strong administrator, Patty Barkey, who many of you know. One of the things that we found having a large operation with, at one point as many as 90 employees, 3 locations in a surgery center, it became important for us to essentially take this as an opportunity to kind of elevate our leadership in our organization, to inspire confidence in our staff. There were people who were kind of uncertain, scared, uncertain of the future and the like, and it was important for us to appear to be organized on the same page and deliver, it's kind of singing the same message in the clinics as well as in the business offices and the like. And we basically established policies that it was her delegated charge to implement and to assure that they were uniformly adhered to provide that consistency and the stability in the organization. And the wonderful thing about that is that it freed me to focus on clinical and patient care, and which was extremely important, dealing with the clinical aspects of COVID in our ophthalmic practice. The other thing that was important with having a point person for the practice is that she was in a position to stay in touch with city, state guidelines, AAO guidelines, ASOA guidelines, ASCRS recommendations, and the like. Plus, she had a network group of other administrators around the country, and they would always compare notes. And this was like almost several times a week, ongoing contact that was comforting to me to know that, that aspect of the practice was under control. And because just clinical patient care is very consuming, as you can imagine.
Yeah, absolutely. I like that idea of, not only delegating, but giving people the opportunity and to step up and have that leadership. And then also, to your point, stability. I mean, I think we were all hoping for, some guiding light, some pillars here and there to kind of point us in the right direction. Wow. So Yari, as we kind of look at what's next, right? Are you guys back in the office? Are you planning to come back in the office full time? What does that look like for AcuFocus?
Yeah, this last year has been interesting for us. It's allowed us, on one hand, to take advantage of an opportunity to kind of shift our energy as a company to maybe invest in some activities and building up maybe more of a digital presence, to working on sort of relaunching our AcuFocus brand. But then also even do some work inside our office so that when people do come back, the experience here is that much more enriching to be in the office. But if you're looking at what, time and when are we going to come back to the office, I was asked this question just today, and, we don't have a set timeline. For us, it's more around what's going to be the most effective for our team. I think if anything was proven over this last year is we are able to execute as a team. We finished a clinical trial. We submitted a PMA. We've started to hire a field sales team. We continue to support our customers internationally, and and when our executive team sat down and looked at what we were able to accomplish, it was actually one of our more successful years as a group, and we did it under such unbelievable circumstances that, I think our CEO, when we first started out, he was very pro, we need to be in the office, it's that much more impactful to have one-on-one meetings, as you need them. But now it's become very clear that, we can work well in this sort of distance environment. So I suspect as we get back into more mainstream work, it'll be maybe a couple, 3 days a week that most people will be here. But, our plan is to just remain as flexible as possible, kind of supporting your data, Kweilin, around, wanting to, have some amount of flexibility during the week. That's absolutely, what we've shown we can continue to work and provide that level of freedom for people to kind of manage their schedule.
Yeah, I mean, I think for us, everybody had to pivot very quickly, right? And we don't have to be in the operating room. It's very hard to do that virtually. Yeah. I understand, taking out a cataract through Zoom might be very challenging. We're not quite there yet technology-wise, but I think we were all surprised at how quickly, we were able to pivot, and it just kind of kept going. I think a lot of the things that we thought would break down society, would break down work, would break that down, didn't happen. We kept pushing forward, and so there's some shining lights that happened here.
Indeed.
So Kweilin, on a more macro level, what are you seeing, about return to work? Is it different for small businesses versus large businesses, or by sector? What does that look like?
Yeah, I think the biggest change or shift is by sector, right? So sectors that have much more in-person work, some frankly have never been working from home, even through all of this. So based on the type of work and how much physical proximity it requires, we're certainly seeing big shifts there. In terms of the impact of COVID, we've also seen big shifts actually by level of leader in the organization, as well as whether you're single or not. In fact, Microsoft did some research and found that more senior level leaders, on average, were doing better. Now there's wide disparity within that than people, for example, who were single and kind of staying at home alone, but not feeling that kind of natural connection and being able to connect with others as much as they typically would. So we've seen a lot of variation in terms of how people have fared in this. In terms of coming back to work, we've seen a range of, open it up, opt in, as people feel comfortable, you can come back to work now slowly and gradually. I think most organizations that we see are planning for more of a formal return to work kind of in the fall, or just a bit before or right around kind of schools reopening. And I think the challenge then will be, how do we make sure that we don't have second-class citizens, that we don't have some people who maybe aren't, for their own health reasons or their extended family health reasons, comfortable coming back. And then we have some people, or maybe most people, in the office, some people not in the office, and you've got a meeting where not everybody is on Zoom, because actually this is very democratic, open, non-hierarchical. But imagine if we had, 20% of the people in person or 60% of the people in person. It changes the dynamic quite a bit. And what we've started to see already with some of the organizations that said, hey, we're going to just open it up, if you feel comfortable, come in, is that all of the people, two things happen. One, if you are single or you have no childcare responsibilities, on average, more of those folks come in to the office. So of course, women on average come in less. The other thing is, when somebody higher up in the organization comes in regularly, they set the tone for the whole organization. So if the CFO is coming in all the time, everybody in finance feels like they have to, right, to kind of show their commitment. If the head of HR isn't coming in, that's setting a very different tone. And so how do we be more thoughtful about setting the right tone, consistent tone from the top, versus kind of bits and pockets depending on that particular senior leader? So I think approaching this more strategically, at the team level, as Yari was describing, we can't have you, Kristen, working Monday to Wednesday, Friday from the office, and me Tuesday, Thursday, and yet somehow we think we're going to collaborate and drive collaboration and innovation together, right? That's not going to work. So how do we think about our team unit? What are the days we need to be in person, working together, truly collaborating, versus, right, I could work and take the call or do whatever just as well from the office or from home. And so thinking about kind of team dynamics much more strategically, I think will make a big difference.
I like this idea of, flexibility, but, and this is something that Yari said before, but purposeful, putting thought behind it, and making sure that we're not forgetting about the people who aren't showing it, who aren't, physically in front of us. I think that's a really interesting point. So, in ophthalmology, we're getting ready to face a whole slew of meetings again. I know we've got Hawaii and I coming up. SECO just happened. I want to hear from our panel. How are you guys feeling about these in-person meetings? Are you excited to see people again? Are you a little apprehensive about some things? What's going on? How about you, Dr. Bowden?
Well, I'm personally very excited about going back to meetings again. It's been obviously virtual meetings have their advantages, one of which is convenience and reduced costs of ongoing maintenance of education. But on the other hand, the other thing I liked about it is that virtual meetings enable you to review them or save them for later review. That allows sometimes little nuggets of information that may have passed you by the first time around, or that after you've studied it a little more, you're more receptive to picking up a lot of details. So that's been nice to be able to have resources that you can, high-level resources that you can refer to, in the future at your convenience. But one of the biggest things that I look forward to is just, maintaining my personal contacts with my friends, my colleagues. It's such a wonderful experience to be able to interact with presenters away from the podium and get the real stories and to compare notes and validate your, views or your experiences and the like. All that's extremely valuable. And for me personally, as an African-American, ophthalmologist, I mean, we constitute like 2.5% of the ophthalmologists in the United States. And the national level meetings has oftentimes been the main opportunity that I've had to network with other minority eye surgeons and to compare our experiences and to share and the like, to support each other and the like, because it's challenging. It's a lot of times we don't show or reveal the stresses that we face, but they're there, and it's oftentimes very reassuring to see a senior eye doctor that looks like you, that's probably gone through what you're fretting and worrying about right now, that can be enough to give you a little extra oomph to keep going.
Absolutely. That's a great point. And I hadn't, I know that you had talked a little bit to me about, the conversations that happen not on the podium, right? So that transfer of information that happens when it's kind of this incidental, clandestine sort of conversation in passing of, hey, I heard you on the podium say X, Y, and Z. I had a different experience. Let's talk about that. Yes. You don't get that virtually.
That's exactly right.
Very interesting. Yari, what about you guys? Are you guys ramping up for the big meetings this year?
It's a weird year for us, right? We're not yet US approved. So as soon as we do, then it'll be full bore. But certainly, I'm going to Hawaii and I on Friday. So I'm hoping that one of my COVID tests get done in time for me to get on the flight. That's the most stressful thing this week. But there's definitely, I look forward to seeing everyone. I look forward to those moments of serendipity when you run into somebody that you haven't seen. You just can't architect that with Zoom calls or reaching out necessarily with everything that's in your day. So I look forward to that a lot. But the anxiety is real, being surrounded by people that you're not sure. Hawaii's probably pretty controlled at this point, but I think that's the one thing that will be interesting to see, sort of that reaction to just being amongst masses of people again, and how that all works out in a conference style setting. So I'm curious to see how it goes. But what's your take, Zaina?
Yeah, I mean, I think, there's definitely a lot of benefits to the virtual meetings. I mean, again, having 2 young kids under 3, being a mother, I felt I was still able to be involved with all the virtual meetings and, doing the webinars and a lot of the teaching. But COVID has been very isolating, and I definitely look forward to the meetings. And there are some things that you just cannot capture virtually. So I don't think it's one better than the other. What would be ideal is if we kind of do a combination of both. Like Frank mentioned, that having them online for a long time to look at these things, that doesn't have to go away. Or having Zoom meetings for some of the administrative stuff or planning things, but then having again, the in-person meetings for connecting. I really miss my friends in ophthalmology, whether it's the physicians industry, and just having those, deep, meaningful conversations. I mean, so many research ideas or innovation starts from running into someone in an elevator after an interesting talk, and you really just can't capture that on Zoom. So I just think that I think there is an excitement, but I don't think we should forget some of the positives of doing certain things virtually.
I couldn't agree more. I think, Dr. Al-Mohtaseb and I both had children around the same time, I think a week or two apart. And I was blown away this year with how many meetings I was able to attend without that pressure of, what am I going to do with this infant? My infant was in some of the audiences with me. And so that was, that was a new experience, but certainly it gave me access to things that I wouldn't normally get. So it kind of removed a barrier for us. Okay, so let's switch topics here a little bit. Let's talk about hiring and team building in a virtual world. Dr. Al-Mohtaseb, you were talking about how you've been bringing in residents and fellows and doing most of that virtually. How is that going? What tips do you have for us to do that well?
Yeah, so, one thing kind of being associate residency director, we really had to make sure that the residents weren't feeling isolated. I mean, it was a fearful year. If you're faculty, you're scared. Imagine being a resident in training when you don't even know what's going on. Some of our ophthalmology residents were taken into the ICU, at the peak of COVID. So, Weikert, who's the program director, and I would do weekly touch points on Zoom, and just making sure that, you're able to connect with the residents and just not get worried about them feeling isolated. All of the fellowship and residency interviews were done virtually. And at first we were so nervous about it. How can we decide whether to take someone into our residency after a 15-minute Zoom call, right? I mean, you're missing the human interaction and all these things. And I think we were pleasantly surprised. Some of the positive is the residents and medical students, they saved so much money not traveling around in the middle of, medical school. We actually did these videos to show tours through our county hospital, our VA, and then our chiefs of service talking about the residency. So, because again, interviewing is a two-way street. They need to figure out, do they want to come to our program? So there is virtual ways to kind of get to know people. We had the Zoom rooms where they can ask other residents, and when the faculty aren't on that. So I think there's a lot of things to be done, and I think there's a lot of positives. I would actually love for it to continue this way, but you really just cannot capture that face-to-face. Not that we were so great about, even when you meet someone for 15 minutes or 20 minutes, will they're going to be the greatest resident? So I think there's a lot of positives, and there's just a way to be able to do these interviews that was mutually beneficial.
I like this increased access and taking some of that burden off of the medical students coming out. I'm sure this whole process was very stressful for them, and I'm sure having friendly faces that were trying to help them on the other end was very welcomed. Yari, I'll throw the same question over to you. You've been building out a commercial team, and you mentioned the other day that you had someone in the office that you hadn't actually seen face to face that you had hired. How is this going for you? What tips do you have for us?
Yeah, it's been it was funny when we first all decided to go back home in March last year. We had actually just hired a new team member in regulatory, and she, we actually didn't even see her in the office. And as we were coming back, maybe about a month ago, saw this individual whose eyes looked very familiar behind this mask, and it's like, Eva, and we just had this moment of I have never actually seen you in person before. So it was just the weirdest thing to have been working with this person for a year, and then realizing that I've actually never met you in real life. So it was kind of a funny moment, but yeah, we're on a hiring craze right now for us, and it's been interesting to get through. All the interviews are Zoom based. We've tried to do some stuff in office, at least, because I think there's, especially with maybe some of these positions that are more, going to be working more cross-functionally, having that opportunity to connect with people, and I think most importantly to get a sense of who you are as a company. right? You totally nailed it with, it's a two-way conversation. If somebody's leaving a known entity and a known culture within an organization, how do you adequately articulate that across Zoom? And I think that's really difficult to do. So we've, tried to have it be as much, conversation with maybe more people than they would do in an interview cycle, but maybe as like groups. And I feel like that actually kind of worked out well, because then you can see a little bit of a group dynamic as you're interviewing with a few people, but not being overburdened with too many phone calls. But yeah, we would have people come in. I think you have to kind of feel out the person's comfort level and your comfort level with the meetings in person. And just, I think the biggest tip I would have is just be fluid and as best you can be as real and authentic. I think that's one of the things that I've found the most important about this whole experience is, this Zoom environment has allowed us to understand people in ways that, you maybe wouldn't normally get, right? Like you have a dog barking, you have people in the background, people are working at, their homes. So you kind of get a little bit of a different view into people and their nature, which I think has almost been a little bit helpful. But certainly, I think to me, the hardest part is communicating the corporate culture and making it compelling to want to work in an environment when you have no way to demonstrate that. So it's the best we've come up with so far.
I appreciate it. I don't think we all have it figured out yet. Kweilin, you were discussing last week how the impact of COVID has had on our workforce, specifically women and women of color, and how that might affect our future workforce, and especially diversity and leadership. And with that in mind, how can we work to create and maintain a priority on diversity in hiring and retention?
Yeah, I think the challenge is it was an unequal pipeline before COVID. COVID has caused us to take 2 steps back. So how do we accelerate the forward progress? One, just close the gaps faster than we otherwise would, and then continue to make forward progress. It's challenging. I think part of the gaps are that women tend to be over-mentored but under-sponsored. They also tend to get less feedback, as we talked about last week. And so making sure that we're equalizing those, especially as we have this kind of open, come back as you feel comfortable approach. But as we reopen broadly, and some may still be having more family and other responsibilities, how do we equalize the playing field and make sure that both in not just hiring, but in retention and promotion, we're aiming to close those gaps as well so that we have more equitable outcomes. I think that's the challenge. But if each of us kind of takes that on in our various groups, and then we proactively say, both to ourselves and others, right, who are you sponsoring who doesn't look like you? I think then you can start to broaden some of our natural social circles, mentorship, sponsorship circles, and hopefully include others that aren't as included. I think one of the data points that really hit home with me is that Black women in particular have been disproportionately affected during COVID, not just in terms of workplace inequities, but also health inequities from COVID-19. And when Black women feel like they have a true ally at work, they report just as high levels of engagement, wanting to stay, feeling authentically valued, like they can bring their full selves to work. And so how do we find or create the situations where more Black women, other women of color, feel like they genuinely have sponsors and allies at work? I think that's the difference. And right now, some of the data shows around 2/3, even up to 3/4 of people say, yep, I'm an ally for women of color. But then that only translates into about 1 in 10 people actually actively sponsoring or mentoring a woman of color, right? So we've got a lot of positive intent. Not much of that is actually translating into concrete action and proactive sponsorship. I think if we can make that translate a bit more, it'll be better for women of color in the workplace, men of color, women overall. I think it'll just be a more inclusive, supportive environment.
And Kristen, if you don't mind, I wanted to kind of say something to jump on this. I think the most important thing is that we're having these conversations finally. I mean, if you compare 5 years ago to now, and I think COVID has brought it to the limelight, all the issues that were present before have come up to the surface. I mean, I'm on these physician mom group Facebook, and the conversation is there. Our medical school applications for residency now have an underrepresented minority click box so that you know who are the underrepresented minorities to take that into consideration. So, I mean, yes, we have so much work to do, but at least we're finally having these conversations. And, acknowledging the issues so that we can potentially, make it better. And I think Yari said a phenomenal thing about the key from COVID. And I think the key from this year is just being honest and true in all your interactions. And I think so much more is gained than when people kind of just put out this persona of, perfection or whatever it is. And I think we can never learn from other people or fix things unless, people share, how they do it or what we can do differently.
Yeah, absolutely. And I think I have so much appreciation for people like Dr. Bowden who speak their truth and say, hey, we're only 2.5% of the ophthalmic community. And that's something that I think a lot of people just don't think about because it doesn't necessarily affect them. But saying it out loud, having these conversations is so important, and it really lays the groundwork for us being able to have more in-depth conversations and just share our experiences and what we've done that's working and how we can kind of continue to maintain that level or increase that level across the board. So, okay, let's talk about, we talked about retention, we talked about hiring. What about team building? How are we keeping our teams engaged and spotting that burnout and taking care of them through all of this? Dr. Bowden, why don't you help us out here?
Well, that's a very good question. What I think to be a leader and to inspire the troops, if you will, and to keep them engaged and motivated and the like, you yourself have to have your act together. And one of the things that I have found to kind of fend off feelings of burnout and being overwhelmed and the like is to challenge myself and to identify needs, services, what have you in the community that our practice could provide. For example, taking on dry eye care and being a proponent to members in our community and around of the importance of ocular surface management and how it has such an impact in regard of what refractive surgery, cataract surgery, and glaucoma surgery, and to be a resource willing to take on the headache, dry eye patients in the community has kind of opened an avenue that has energized my practice and provided an alternative revenue stream, for example, that other people have dismissed and as not being, viable. Other things that we've done is to embrace new technologies within our practice as a whole. We've recently embraced the NeuroLens technology in our practice to address an unmet need of eye strain, computer vision syndrome, things like that. And so I'm learning about it. My optometrists are spearheading it, and it's a practice-wide initiative. I've challenged myself with learning other surgical procedures, and one of which that I'm very proud of, Zaina is not aware, but she played a role in it, and that I embraced secondary intraocular lens implantation via transscleral fixation. And I essentially did what the ASCRS meeting, virtual presentations, and I essentially got a practice eye and used, practiced, did a wet lab in my own surgery center and basically got the nerve and the patients, and I did several cases that went flawlessly, and I'm just so proud of myself that I've embraced added a new procedure to my armamentarium, and it's good for my staff to see these things and for me to get excited and for them to get excited for me. So those are things that I've done in our practice.
Oh, that's great. I like that. Bringing on new, keep yourself learning, like bring on new toys, get yourself something to be excited about. Those are some great ideas. Yari, you had mentioned something that stuck out to me about being purposeful. How are you, with these new team members coming in, how are you making them feel like part of the team?
Yeah, it's important to stay as connected as possible. So every week we have actually right after this call, I have my team call. So even if it's honestly, when we first started out, it was the first few months, it was, probably more social just to try and keep people feeling some semblance of normalcy. And now it's kind of moved into more, business and strategy and really accelerating where we're going with the company. But I think one of the things that became very clear to me was that everybody, as we work through this, is dealing with stress and dealing with so many different pressures you can't possibly understand. That, one of the things I tried to do with my group is just encourage, those moments of if today is just not your day, just take it off and give yourself the self-care that you need. And so, trying to encourage people to just be sort of aware of the stressors in their life and to take care of themselves first. Because at the end of the day, that time is spent off is actually more productive than having the team, that person be, stressed out and struggling at work. So that's, we've tried to just allow people that grace to, have a life and have stress and acknowledge that and take the time to face it head on rather than try to push towards a strategy. And it seemed like that's been very positive, so having that flexibility and trying to keep things light. I think there's so much that's heavy, and that's partly why I did all that ridiculousness early on in COVID, was trying to find moments where you could laugh and not take yourself so seriously. For a long time on our Zoom calls, I would be wearing one of my 400 wigs. So you never knew which version of myself. This is a super funny anecdote, but one of the women on my team, her daughter, saw my hair as it is now. And she's just like, is that a wig? I think this is her best hair. Why does she wear all these other ones? And it's like, wow, I apparently have leaned into that a lot. But to me, that's, I think, what's been the most helpful is not taking yourself so seriously and allowing people grace to go through the stresses and the bumps as you need to. And it's okay to check out for a day and then come back refreshed. But so far, so good, I think. I'll find out on my next call, I'll let you know.
We'll expect some notes. So let's kind of look at the bright side of things. And Kweilin, I'm going to start with you, actually, because you have a different experience than most of us in ophthalmology. What do you want to see stick around from this COVID experience? And what do you want to just gladly get rid of and not see again?
I'd love to see a couple things stick around. I think a focus on what matters most and a focus on more balance and family time has been a nice silver lining for many of us. Less travel at the margin has been great. And then I think this democratization of participating, right? You don't walk into a big boardroom and there's the senior leader at the end of the table, and then there's discussion and figuring out who has a seat at the table. It's just everybody is an equal box on Zoom or Teams or whatever, pick your favorite video conferencing platform. And if you can't get a word into the conversation, you can use the chat. I think there's a real kind of inclusion and participation to that. And I hope we can preserve that as we go back or partially go back over the next little bit.
Awesome. I'm going to kick it over to you, Dr. Al-Mohtaseb. What do you want us to keep and what do you want to get rid of?
Yeah, I mean, I think some of the flexibility that's gained by doing, obviously as physicians and surgeons, we can't do remote work, right? Seeing patients or doing surgeries, but there are some things that we can do remotely. Some of the administrative meetings or, some of the educational aspects like lectures and so I think just some flexibility and some loss of driving to go to meetings from different, hospitals, I think is huge. And I agree completely with Kweilin is knowing what's important, spending so much family time and just reassessing what matters and focusing on doing a phenomenal job on less things so that, you don't just, it's not this rat race that you get back into the way it was before. It really COVID stripped all of these extra things that we used to do that used to take our time. What I do want to get rid of is the isolation. I'm a very people person and I miss hugs, right? It's just the human interaction that we're missing is very hard. Just looking at my two kids, my daughter, everybody saw my, 2.5-year-old daughter when I had her, and my son, who's a year now, I would say saw like maybe, 10 or 20 people live, which is just so different. So definitely get rid of that.
Yeah, I think a lot of people are agreeing with you on the isolation, but Yari, how about you? What do you want to keep? What do you want to get rid of?
Well, I'd like to keep elastic waistband pants. Is there a way that we can make those like fashion? That'd be excellent. There's so many conversations about what to wear when now that we're back going into public. But I really like to keep, and I saw one of the comments come through the chat. I really like the idea of having this sort of Zoom environment. I'd say let's get rid of Zoom and also keep Zoom, but let's have it be something where it's a beneficial way to kind of enhance the experience that we're in, right? And have the ability for attending conferences if you can't, if the timing doesn't work to be there in person, but have it be, have that virtual element be available. I think that is so beneficial. And I think what Dr. Bowden said about being able to go back and listen to things again, I think all of the work that, both he and Dr. Al-Mohtaseb put into all of their talks, all the education. That's the one thing that I've always found frustrating, is that they kind of happen for a moment, and if you're not there, you miss it, and then all of that effort is gone. So I love the fact that having this level of education be available on demand just gives it extra life and the ability to spend more time with that knowledge and kind of dig into it to learn new skills. So I would definitely love to see a thoughtful virtual component persist as we move forward through into the next phase.
Awesome. Dr. Bowden, how about you? What do you want to keep?
Well,
what do you want to get rid of?
Totally with what Yari just stated. One of the things that I would like to see is a continuation of everyone's preoccupation with germs and communicable disease and the like, and for people to not bristle at the idea, if they don't feel well, don't come to the office,
Yes.
and staff as well as patients. I mean, I can't recall people being out with the frequency of flu, colds, and the like. Now that everybody's wiping down surfaces and wearing masks and the like with regularity. So that's one thing that I thought that would be, a nice thing to kind of retain in some fashion, this increased awareness to keep everybody healthy. The thing I'm anxious to see an end to as the pandemic goes away is stability in our staffing in our offices, and where people are no longer incentivized to stay home and stay away because they're making reasonable income from the government just because. And that's been a real challenge to just deal with the ebb and flow of patients, of staff members in and out because of variety of concerns.
Understood. That would be very stressful, trying to deal with inconsistencies in staff.
Right.
Yeah, I think we had a lot of these conversations, and one of the things that kept popping up to me was, the fact that this was kind of the great equalizer. We all had to take a stop and pivot for a moment. Everybody had to change what they were doing. Surgery centers were shut down, offices were shut down, hospitals. I mean, you were talking about residents having to switch over to the ICU. I mean, everybody had to stop and take stock. And this was a great equalizer for all of us, having to learn new technologies. I mean, I had never heard of Zoom prior to March of last year, I think. And I think that there was an understanding and some grace is I think Yari put it to me, that we all had a little bit more grace for one another. We understood there was a dog barking in the background. I had wonderful clients who laughed away my baby crying as I'm bouncing around on conference calls with a baby strapped to me, because we didn't have care at home. And the show must go on. You guys have patients, we have clients, clinical trials. So you do what you have to do. And I think everybody had a lot more grace and a lot more humanity about business. And for me, that's what I want to keep. I look forward to the day where we can shake hands again, maybe not hug. I'm not a hugger, but I do love a good firm handshake. So I look forward to shaking all of your hands again in the near future. And gosh, I appreciate you all taking some time out of your day to be here at Kweilin. Dr. Al-Mohtaseb, Yari, Dr. Bowden, we really appreciate you. We appreciate everybody for coming, and thank you to our panelists for being here today.
Thank you.
Thanks, Kristen.
You guys.
It was a blast.